Giving birth in the United States can be dangerous. In fact, a newly released USA Today investigation found it's the most dangerous place in the developed world to give birth. While other developed countries have experienced declines in maternal deaths over the last 25 years, the United States has seen a drastic increase. Though the majority of women give birth safely, approximately 700 women across the United States die each year as a result of pregnancy or pregnancy-related complications. Obstetrician gynecologists like Dr. Barbara Levy say many of these deaths are preventable with correct prenatal care through a specialist.
There are primary care physicians who do have training in maternity care. Most don't. And so there are a lot of changes that happen to our bodies during pregnancy. It takes a little bit of special training to understand.
Women typically see their OBGYN about once a month at the beginning of pregnancy, and those visits only get more frequent as the pregnancy progresses.
You don't want to scare people with the bad things that can happen, but bad things do happen and we want to be prepared.
But regular visits to a maternal care physician can be a struggle to women in rural communities. The American Congress of Obstetricians and Gynecologists say 1 million babies are born to mothers who did not receive adequate prenatal care every year. In Wisconsin alone, a third of women don't have access to a specialist.
26 out of 72 counties don't have an obstetrician, gynecologist. Sometimes people forego the care that they need. And I can't tell you how many stories I've heard of people in labor, women in labor, driving an hour and a half to get to a place where they can deliver their child.
With 2,340,007 women in Wisconsin and only 556 OBGYNs, Senator Tammy Baldwin says there isn't enough care to go around. She wants the National Health Service Corps to specifically target maternity care resources to lacking communities.
This is right now a sort of generalized review of which areas are underserved, but it doesn't look specifically at maternity care.
Her bill, co-sponsored by Republican Senator Lisa Murkowski of Alaska, would direct the NHSC to do just that. Both the senators and Dr. Levy agree negative outcomes could be prevented with more access.
There can be an intervention that really reduces the chance of either maternal mortality or underweight birth.
Dr. Levy says there needs to be a system created to put these doctors into underserved communities while also supporting their careers.
So if you're in a place where there are not a lot of pregnant women, trying to maintain a practice is challenging, and keeping a workforce of nurses who are highly trained to manage labor is really tough. I mean, how do they keep up their skills if the volume is really low? And if they're only doing, one delivery a day, they may never see that emergency for a year.
Both Dr. Levy and Senator Baldwin say they're disappointed at the disparity between the United States and other countries.
If you live at home in a system like Great Britain, where it's all planned out, and if something happens at home, there's a set of guidelines that say if this happens, you get transferred to the hospital, and you can get there within 5 or 10 minutes, that's great. If you're in rural U.S., and it would take you 2 hours to get to the hospital, that could cost a mother her life, a baby a life, or lifelong disability.
It's kind of shocking to see how far behind we are in many cases.
With the Centers for Disease Control estimating 60% of pregnancy-related deaths each year are preventable, the senators are eager to make progress in protecting mothers, and they say this bill is a good start. The bill has not yet been passed out of committee in the Senate. The House passed a companion bill in January 2017.